Good morning. Good morning. My name is Kathy Schwan. I'm the North Dakota AARP Volunteer State President. And we do this AARP on Tap on the third Friday of every month. And it gives us a chance to look at what's down the road for 2022. And needless to say, prescription drugs is top and center on our list. Last month, we had a chance to speak to James McSpadden, and he was from the AARP Public Policy Institute, and he gave us some insight into how drugs are priced to medication for older adults. And it was leading up to his testimony at the Interim Healthcare Committee meeting that was held on March 2nd. But before we get started, I'd like to remind you that we are recording this event so we can share it with others who couldn't be with us today. And if you'd like to ask questions, please use the chat or the Q&A button down at the bottom of your screen and type in your question, and we'll be sure to get to them. Today, I'm excited that we have a guest from the North Dakota Insurance Department. His name is John Arnold, and he's the Deputy Commissioner, and he's involved with the updates to the committee on the role the insurance department plays as it relates to prescription drugs. Welcome, John.
Hi, Kathy. Thanks for the invite.
Oh, we're so glad you're here. Can you tell us a little bit about yourself in the insurance department and your role there?
I've been with the insurance department for about 2.5 years now. The insurance department, we regulate the insurance industry in the state. And really, there's two core aspects to that. First is making sure that the insurance companies are solvent, and so they do have enough money to pay claims. That's a big part of what we do. The other big part, and probably is more important to your membership, is the consumer protection aspect of it. If an insurance company maybe isn't honoring their promises, if a claim isn't being paid that they feel should be claimed, we're a resource that consumers can reach out to. And sometimes that resource is more educational. We can't promise that claims are going to be paid. Sometimes it's explaining why the policy language was the way it was. But there are people that we're able to help. And so we definitely encourage people to reach out to us.
Can you talk a little bit about your role from the last legislative session, House Bill 1032 on the prescription drug transparency bill? It was passed by the legislature and it went into effect in August. And the insurance department is responsible for implementing this law. Can you give us an update of where that stands?
Yeah, 1032 was passed requiring certain disclosure reports from 3 different types of entities, one being drug manufacturers, another insurers, and what's called a pharmacy benefit manager is the third one. And so starting last August, we started requiring filings from those entities. And we post those reports, disclosure reports, on our website. We just act as that depository. We don't interpret the data. We don't do anything to kind of suss out what it means, but we make that available to the public.
Well, what happens from here? What's the next event that takes place having to do with that bill?
Well, we've already, since started in August, we've had 2 quarterly reports, 2 rounds of quarterly reports from the manufacturers. We also receive new drug notifications if a new drug exceeds a certain price threshold, and also price increase reports. And we've received those pretty steadily since the law went into effect. Coming up here on April 1st, the insurance companies and the pharmacy benefit managers, PBMs, have their first filings due. And so I think really with that data, a researcher, and I know AARP is working with some people to kind of look at that data and find out what trends are. The more data becomes available, the better analysis can be done. Again, we've got 2 quarters of the quarterly reports from manufacturers in already. The third quarterly report is going to be coming up here in April. And so we'll get more and more data. And I really think, a couple of years down the line, and I know that's, pushing things out a little bit more than people may like, you'll start to really be able to look at and see what trends are. But I think we need to build up that data over several reporting periods to be able to get a real good understanding of what the prices are.
Now, I've got kind of a selfish question because it happened to me, but there was a drug that I was on that within a 2-week period from December 14th, when I got it filled, to January 1st, it went from tier 2 to tier 4. So it went from $0 to $267 a month. Are they required to work with the insurance department when they raise the price just by changing the tier?
Yeah, within the tier and the policy, and a lot depends on the type of insurance you're on as well, because we don't regulate the Medicare plans, for example. And so if it's with that, you'd have to, our staff maybe wouldn't be the greatest people to work with. But if in terms of changing a health insurance policy, something you maybe buy on the public market, or an insurance policy perhaps through an employer, that is something people could call into our consumer assistance representatives and say, hey, the plan language changed. From the time I bought it, the plan is supposed to be good for a year, but they've changed the terms on me, or I suspect that they've changed the terms on me. That's something somebody could call in and ask for help with.
Okay, because they aren't required to publish the formulary during that open enrollment period. So you really don't have a way to make that judgment.
True, yeah.
Yeah. And, often we think that the issue of prescription drugs is really more for those of us that are in the AARP age category. But I was talking to a friend the other day, and his 26-year-old daughter is a type 1 diabetic. And of course, she's no longer on his insurance plan. So she's a school teacher, and she pays over $1,000 a month for insulin. And, certainly relief needs to come at just about any age. I have a grandson that's a type 1 diabetic, and luckily, my son was military, so they don't feel the pain the same way. But wow, it's pretty tough if you expect a 26-year-old to cough up. And that's with insurance. She's got insurance through the school system that she works for.
Yep.
So that's
those cost shares can get to be a burden.
Yeah. And so we're not just fighting for the 50 plus. We definitely are looking out for anybody that's in this scenario. Now, do you have a website that you want to share with us to tell us a little bit about?
Yeah, insurance.nd.gov, and I can share that with you if you would like. And let me know, Kathy, if you're seeing it.
Yes, we can see it.
All right. So right now, under prescription drug transparency, we can look at the file disclosure reports. And this isn't the most user-friendly at this point. The funding source that came with House Bill 1032, we don't actually receive any of that funding until this summer. And so we kind of had to just utilize our current resources to be able to make this data available to the public. But we are going to be working towards building a system that you can actually search for things and be a little more user-friendly. But just looking at, for example, at the drug manufacturer price reports, we have the third and fourth quarter reports available from 2021. You can click on there and sort it alphabetically by the name of the drug manufacturer. You can open up the reports and see what the wholesale acquisition cost is for those prescription drugs. And it's not a retail price. I want to kind of stress that a little bit. It's not what you're going to be paying at your local pharmacy. This is what the drug manufacturers sell it to those wholesale dealers. That's the price that gets reported to us for these. And that is some of them, to your earlier point, Kathy, with the cost of some of it, I've opened up some of them and taken a look, and there's a lot where the wholesale acquisition cost is $5, $10, $20, but then you find the random one where it's $50,000, and I'll search for that drug medication or that drug and find out that it's for some rare form of cancer. And that's where I was saying earlier, we don't interpret what this data means. I don't know the level of research that went into that. maybe that is a fair price given the amount of work that went into that. And if it's a life-saving medication, that's certainly something somebody has to consider as well. But I guess I would just urge people to realize what this is. It's the wholesale acquisition cost. It's not necessarily what you're paying at the point of sale. It doesn't take into consideration insurance or any of that other stuff. So,
That's a really good point, but the absurdity using the insulin example
yep.
is that it is a life-saving medication.
Mhm.
And the patent originally was put out there years and years ago for $1, just so that nobody really had to worry about getting insulin. And now it's so unaffordable for a lot of people.
Yep.
I know a lot of other states have looked at putting caps on the price of insulin, and I certainly hope North Dakota really entertains that possibility. It's just, it'd be a good start for a lot of people that need that,
Yep.
regardless of their age.
Yeah, and I know that's one thing that gets discussed during the legislative session pretty often.
Yeah, and it deserves to be.
Yep.
I don't see any questions out there, but I think that we probably provided the kind of the baseline of the progress of what's being done. So can people on your website also make comments so that you've got information about the types of issues that people are having, or is there any opportunity for that?
Yeah, let me share my screen again, Kathy, and I was gonna kind of highlight some other things for you towards the end here.
Okay.
Maybe this is a good opportunity.
Yep.
On our website, the one thing I really want to highlight for your group is the SHIC Medicare tab down here. SHIC is the State Health Insurance Counseling Service, and we help provide a lot of information for people getting ready to enroll in Medicare during the annual Medicare Part D open enrollment every fall. We assist a lot of people, and that's another resource. We like to say we're one of the best kept secrets in North Dakota, and we don't like that. We're trying to get our story out there. The more people that we can help, the better. Especially, talking medication with the Medicare Part D open enrollment for those prescriptions. We do help save people a lot of money every year by going through and shopping. And it's just offering that assistance when shopping for a plan. Even somebody on a limited income, if you can save $100 a month, that's life-changing. And we do that on a regular basis for our consumers. So I definitely would encourage anybody to come out to our website, look around, especially, like I said, right here, we've got the big SHIC Medicare button. Look on there, reach out to our counselors. I know our counselors are also working with AARP. There's going to be someone presenting at your quarterly meeting later this month on the 29th. And so that's another opportunity to touch base with the department. And then we also, on a quarterly basis, send out postcards to North Dakotans who are going to be turning 65 within that upcoming quarter. Just introducing ourselves and letting them know that they're now going to be eligible for Medicare enrollment, and we're here to help. So definitely pay attention if you're approaching that 65. Look forward to one of our postcards and reach out to us.
Well, that's great news, and your secret is no more. I learned something here today. One question I have on the Medicare link that you had there.
Yeah.
When a person goes into mymedicare.gov, there's an opportunity to look at your drug prices, because you enter your drug prices in and it gives you the information. And a lot of that will help drive which plan you select.
Correct.
Does this pull from the same database, or?
Yeah, our SHIC counselors and our volunteers, they pull from that same database during the open enrollment period to help people select those plans and find out which plan would work best for them. Okay,
that's good to know. I think a lot more people are signing up for mymedicare.gov just to help them make that decision, because you're bombarded with literature and you see the, the Joe Namath commercials and everything else, and you think, oh, well, I'm being cheated out of this. I should be getting reimbursed for this. And it creates such a complexity of questions, and every resource out there really does help people, try and figure it out. One thing that's become very helpful is during the period of the pandemic, there's a lot more people that know that you have to get online to find some of these resources. Virtual doctor appointments have helped clear up some of that, the jitters that comes with trying to communicate online. So it's nice to see more seniors are actually on the web and looking for this type.
And if anyone is uncomfortable with going on and accessing that portal themselves, that is something SHIC can help with as well. We collect your list of medications, how often you take it, and can work through that. And again, it's a free service just to help out the consumers in North Dakota. And it can't stress enough how much money we can help save people. My mom actually has worked as a counselor and helped, and so I've heard some of her stories. Just the amount of money she can help save. It's kind of a point of pride that I help somebody save X amount a month, and for some of the people they've had to decide whether they were going to cut cable and their newspaper subscription, and then they get to keep it, and they get to maintain that connection to the outside world a little more, especially if they're bound to home a little bit.
Well, there's always peace of mind knowing that you've got your medications in the cupboard, for 3 months at a time, and you're able to know that you can afford it the next time the prescription is due. So we appreciate what you're doing, and also appreciate that you were here today to tell us what the status is. Any other closing thoughts?
No, just again, stress that insurance.nd.gov is our website. So you can hop on there. We focused a lot on the prescription drugs and the Medicare portion of it. But again, the consumer protection goes beyond that. If there's a problem with auto insurance, homeowners insurance, anything like that, we are here to help and encourage you guys to reach out to us.
Well, thanks for joining us today, John. We really appreciate it.
Hey, thank you for the invite.
Yep. And now Janelle is our advocacy director, and she's going to put up some slides to talk about how to stay connected. And also, these are some of the events that are coming up. Social Security Retirement Readiness is always one of the most widely attended event, because you never can learn too much about that, whether you're helping somebody else or for your own situation. And then Medicare Retirement Readiness, you've got some advanced time that you really should take advantage of when you apply for Medicare. But there's fun things too, the virtual museum tours, home fit, making sure that you can live in your home longer. And of course, we're coming up with voting events starting already. It's hard to believe it's that time again, coming up in June and again at the end of the year. And on April 15th, we'll be talking more about plans for voting for the June primary. So thank you so much for joining me, and take a look at the links to stay in touch with AARP. And many of you are probably tech savvy, and you can do that QR code and learn how to stay in touch with AARP. So thanks for joining today, and we'll see you next month.